Greetings, good sirs, madams, and those of indeterminate gender. I am thy humble host, Hannah, and this doth bring thee under the scrubs. Hear ye, welcome back, good folk, to another Tale Doth podcast. Lo, today we stand upon the cusp of a great reckoning. Forsooth, too long have we suffered the heavy boot of the hospital upon our backs, too long have they treated us as mere chattel, and too long have we borne their scorn and disdain. On this day we shall discourse upon unions, why we hath need them, the boons they bestow, and what must be done to forge a new path for our labors. Physicians, nurses, nursing attendants, surgical knaves, keeper of the hall, and stewards of the cookery, we all may join hands in union and rise against the cruel yoke of the healthcare lordship, demanding fair treatment and just reward. I'm honestly embarrassed to tell you how long it took me to translate that, so we're just going to pretend I did it on the fly and that I'm really smart. So, in case you couldn't tell, yes, today we are discussing unions. So, I'm going to jump into my timeout and then we're going to start talking, okay? Here in the US of A, deportation is a hot topic this year, and I'll tell you what, I do believe in deporting, but only for a certain group of people, okay? And I don't care where you get deported to, just as long as you're gone. If you use the word prego, okay, she's not spaghetti sauce, she's pregnant. Boom, you're deported, okay? Slow walkers, you're gone. Don't walk -2 miles an hour in front of me when I'm moving at the speed of sound, okay? People with poor spatial awareness, all right? Let's say, you're standing in line, you're going to order a coffee, you got some hot bitch standing in front of you, just taking her sweet time to order. And then after she, places her order, she turns around and giggles and does like that half-hearted apology. Oh my God, I didn't know there was all these people, right? Like, did you think you were the only person in the coffee shop? Or, oh my God, Costco. Don't even get me started there, okay? I don't push the cart in Costco anymore because I'm not above using that thing as a battering ram. Like, you leave your cart in the middle of the aisle and you're just going to walk off and grab something and it's blocking the flow of traffic, I'm hitting it, okay? I don't have to have insurance on that thing, so I am not below hitting your cart with mine. Okay, boom, you're deported. If you say O2 stats when you're talking about oxygen saturation, you're gone. Or medically induced coma, bye. If you tell me my dog isn't my child, I have a sonogram that I will post to my Instagram to prove she is. All right, and I even get Mother's Day presents. Brooks Walter. But who is that, Hannah? He is the inventor of parallel parking. If that is the only parking spot available or I gotta walk 3 miles, baby, I guess we're walking. Hope you have some good shoes on. Pharmacy. If I call you and I tell you that I need a patient-specific med, but I've already looked in their room, I've already looked in the patient-specific bin in the Pyxis and the tube station, and you hit me with the, did you check the tube station? The only thing I should hear after that is silence because you've been deported, okay? Left lane drivers who just drive in that lane and they're not using it for passing, boom, deported. Off-leash dog walkers, okay? Now that my poor sweet angel baby has become reactive after getting attacked, I'm so hyper aware of people who just let their dog off leash when they shouldn't. They're like, oh, don't worry, my dog's friendly, right? Okay, I'll mace you and I'll mace your dog. And then I'm going to deport you, okay? I mentioned this on a previous timeout, okay? If you share your whole relationship on Facebook, but you won't disclose why you guys broke up, I'm an involuntary historian now, and I can't finish the lore that is your story. Deported. If we approach a red light, all right, and instead of just driving up and then coming to a stop, right, you ride your brakes and then idle super slowly to the car in front of you, you're out of here, okay? I thought that was the last one I had, but it looks like my co-host and my mascot, Fern, she slipped this one in. If you have a dog and you don't give them a frozen peanut butter Kong or a frozen peanut butter lick bowl every night, you are done and deported. That's animal abuse. I don't make the rules, I just follow them. And yes, she actually does get one of those every night. And I buy powdered peanut butter in bulk, so it's less calories, less fats, less salt, and more protein. So she is the result of a dink. So today's episode's sources are National Labor Relations Act, National Bureau of Economic Research, American Journal of Nursing, In These Times, National Nurses United, PubMed, and HeraldNet. I might get a little heated, okay? So this whole thing is going to be a soapbox. Originally, I hail from Washington. I've been a part of a union before for my nursing job, and I did not realize the luxury of having one until I worked a job that doesn't unionize, okay? I got the fun little opportunity to attend a meeting that covered the basic guide to the National Labor Relations Act, where we discussed unions. Coincidentally, there was also this fun little study that was printed out and handed out that discussed the evidence of the effects of nurses' strikes. And I'll touch on that in a minute, okay? Now, if you've ever been to one of these meetings, they are thinly veiled threats that unions are bad and we will start firing people if you try to unionize. Now, if I mentioned that, they would have vehemently denied that, okay? Because it's illegal to fire people because they are unionizing. But I think it's time to cut the brain rot, okay? And I'm going to reference the law from the nicely printed handbook that I got. And I have to say, this paper, she's thick, she's glossy. The kind of paper that screams, we paid too much for this paper to get printed, and about 90% of you are going to toss it into the trash. So we're really just tossing money into the trash. And to that, I say, hospital, if you ever want to throw money in the trash, you can just go ahead and toss it in my bank account. That's fine. You can also trust that I'm going to get my use out of this packet. So shout out to them. The National Labor Relations Act, the NLRA, is also known as the Wagner Act. It is a foundational U.S. labor law that was passed in 1935, and it guarantees private sector employees the right to organize into unions, engage in collective bargaining, and take collective actions like strikes. Now, there are some jobs that require you to be part of the union, right? Like it's mandatory, and if you want to opt out of it, you're not going to have that job. Nursing doesn't fall into that, but if you are part of the union, you get like the protection that they offer, the benefits. You also get voting rights when it comes to like new contracts and having your voice heard. So let's pretend we have a contract with this hospital. I'm making this name up. And if it just so happens to actually be a hospital, I seriously had no idea. We're going to call the hospital St. Cletus. Okay. Our contract is for 2 years. And once we start getting closer to the end of that contract, you'll start hearing from your union, hey, you better start saving money now. Our contract's coming to a close and we're going to start negotiations. This is in case of a strike because it's really important to have, a bit of a savings. So our contract's going to come to an end and negotiations are going to start. But prior to those negotiations, all those involved in the union are going to be given a list and they're going to ask to prioritize the issues, right? And this is so when negotiations start, there's like a consensus of like what's important, right? So maybe you'll say higher pay, safer work environment, and you never get your breaks. So you want those three things are like the top that like you absolutely need to have them addressed, okay? Now negotiations can take months, and maybe you get to a point where just neither party's really budging. You don't get, any kind of tentative agreement. So your union puts out a vote to authorize a strike. Majority of nurses vote, hell yeah, brother. So legally, you are required to give notice. It's typically 10 days from what I've seen. But just to cover bases, I've seen a lot of unions give like 11. So you give your notice. Sometimes there's like a Hail Mary, meeting where you try to come to an agreement. You don't get that. So here you go. It's showtime. You call out from work and you tell them that you're not going to be in and that you are on strike. Now, unfortunately, there is no pay and you cannot use PTO to cover your missed hours. But that's why, like I said, it's so important to make sure that you really have a good savings prior to the end of the contract and keep saving in case of this. Majority of unions, though, have a reserve to help those striking cover costs. So like, let's say you're like, I need $80 to pay my power bill or we're going to be turned off. Okay, your union would be able to help you with that. So there are different types of strikes. One of them is strikes for a lawful object, and it's like an umbrella for economic strikers and unfair labor practice strikers. Economic strikers are typically after higher wages, shorter hours, or better working conditions. They retain their status as employees and they cannot be discharged, but they can be replaced. But just hold on, okay? Now, my fun little meeting had us read the next sentence that says, if the employer has hired bona fide permanent replacements who are filling the jobs of the economic strikers when the strikers apply unconditionally to go back to work, the strikers are not entitled to reinstatement at that time. Ooh, spooky, scary, huh? But of course, we didn't read the next sentence out loud and skipped it, but don't worry, I'm going to shine a little light on it. It says, however, if the strikers do not obtain regular and substantially equivalent employment, they are entitled to be recalled to jobs for which they are qualified when openings in such jobs occur if they or the bargaining representative have made an unconditional request for their reinstatement. Huh. I wonder why we didn't read that sentence out loud. Surely they're not doing that whole fear-mongering tactic, right? It's also kind of funny because there's another sentence in there that says, if the board finds that the economic strikers or unfair labor practice strikers who have made an unconditional request for reinstatement have been unlawfully denied reinstatement by their employer, the board may award such strikers back pay starting at the time they should have been reinstated. So yes, the hospital will hire travel nurses for strike contracts. They are called scabs. The contracts are usually a shit ton of money, and you want to know why? Because they are working bare bones crew. You could be ICU with 3 to 4 really sick patients. You could be med-surg, med-tele, whatever, with 8 patients, okay? You get paid so much because you're risking your license being there. And let's be real, travel nurse pay versus staff pay is different, okay? We're not looking at COVID money anymore, but it's still more than what I make, right? If I took a strike contract and I was making several thousand a week, and then that hospital turns around and tries to offer me a position to replace their own staff that are on strike, number one, hell no. Those nurses are on strike for a reason. And 2, you would not be able to pay me enough. But the hospitals that want to prevent unionizing, they will tell you that we're going to replace you. I'd like to see you try. If you wanted to replace me right now, I can go back to Washington and make $20 more an hour. Oh no, woe is me. What will I ever do? So that little study I had mentioned, the one that was handed to us at that meeting, the evidence on the effects of nurses' strikes. This is research that matches data on nurses' strikes in New York State from 1984 to 2004 to data on hospital discharges, including information on intensity of treatment, patient mortality, and hospital readmission. And will you believe it? Strikes are costly to hospital patients. In-hospital mortality increased by 19.4%, and hospital readmissions increased by 6.5% for patients that were admitted during a strike. The author of that said hospitals functioning during nurses' strikes do so at a lower quality of patient care. And you want to know why? Because they have travelers running the hospital with a bare bones crew, and they don't know shit about dick. You know what else that means? Patients are also going to avoid going to that hospital because that means, there's issues, so less money. If you were coding me in the back of an ambulance and you tried to take me to a hospital that had staff on strike, I would literally wake up and say, no, next hospital, don't stop here, keep going. It would cure me, okay? I know this study was supposed to make us feel bad, but joke's on you because that was beaten out of me a long time ago. I care that patients suffer because of hospitals' greediness, that they refuse to come to an agreement on a contract and they force staff to strike. Patients also suffer from the greediness of insurance companies too, okay? So that study offers their parting statement that hiring replacement workers apparently does not help. Hospitals that hired replacement workers performed no better during strikes than those who did not hire substitute employees. In each case, patients with conditions that required intensive nursing were more likely to fare worse in the presence of nurse strikes. So baseline, hospitals don't want you to unionize. They'll say it's bad for the patients when it's actually even worse for them if you do, right? is so easy to control people by keeping them in the dark, keeping them ignorant, and threatening them. Okay. Something that is a scare tactic is in Section 8A3, discrimination against employees. This section talks about unfair labor practice for an employer to discriminate against an employee that could be encouraging, a labor union. So they cannot fire you for forming a union, but the act does not limit the employer's right to discharge for economic reasons. So the employer has the right to discharge, transfer, or lay off an employee for genuine economic reasons or for such good cause as, disobedience or bad work. So this could be used as a guise that they will fire someone for forming a union, but then they're going to be like, no, there was bad work, they had really bad behavior, because they're trying to prevent being sued. That doesn't mean that you can't, still sue them. Okay. The hospital can fire, a couple people, but when you have more and more nurses that start standing together, you can't fire all of them. And that's the problem. They don't want you to gather and support each other and pursue a union. They want to single out a few and cut them off to prevent the union formation and then require these stupid ass meetings that are anti-union. Okay. We're going to look at Ann Waite. She was a respected RN that was fired by Affinity Medical Center, and she was reported to the Ohio State Board of Nursing as a form of retaliation for her union activity. Ann took her case to the National Labor Relations Board, and Judge Arthur J. Amchan found that the hospital's complaints were baseless. The facility was ordered to reinstate Ann and formally rescind its complaint to the nursing board. The hospital, though, continued their harassment, so Ann said, "Screw you guys, I'll see you in civil court," and she was awarded $1.5 million in damages on top of attorney's fees, finding that the hospital acted out of malice and attempted to defame her even after she had been legally reinstated to her position. They were lying, saying that Ann was lying and falsifying documentation on patients' charts. Lacey Little, she was a nurse at Indiana University Health, Inc., where she was wrongfully terminated on March 30th, 2015. That firing just so happened to occur 3 days after Lacey began trying to persuade her coworkers to unionize. Lacey began trying to get her coworkers to unionize when she recognized the increase of moral distress, the amount of people that were going home and crying because they felt like they weren't able to take, good care of their patients due to cutbacks, because the IU health system, quote unquote, was going lean. Lacey felt like unionizing was a way to stack up enough people so that they were on a level playing field with the CEO. IU nurses began holding informational meetings 3 times a day, twice a week, to discuss issues and how organizing could help iron them out. Lacey was incredibly careful getting her colleagues to sign the union card on their breaks so it was not on company time, but IU Health Inc. caught wind and fired her, lying and saying that she was doing it on company time. Not long after Lacey's wrongful termination, the state health department issued a report saying that the hospital was short-staffed and it was adversely affecting patient care. The United Steelworkers Union, they picked up Lacey, they hired her, but the termination threatened her license, and so she knew if she sued the hospital, she would win. But that can take time, and she wasn't able to work. So she ended up taking a settlement deal with IU Health, Inc., and that they rescinded her termination and the discipline against her. And then they made a statement that the federal law forbids the hospital corporation from threatening, interrogating, surveilling, disciplining, suspending, or firing anyone for attempting to form a union. So they didn't give her her job back. And I mean, she was able to get a new one and keep her license, but they just, undid the firing, which is crazy to me. So that's really the threat of it, right, is getting fired. But if you do get fired, right, you link up with the National Labor Relations Board to sue and you get your pound of flesh. Okay. I also go back to like how they can, they can fire a couple people, right? Maybe like 1 to 3, but the more you start adding on, the more difficult it gets. When you are unionizing, you have to be so careful and quiet about it. You have to know and trust that the people that you are talking to aren't going to turn around and rat you out to management. And if you are someone who has done that, ratted people out for trying to unionize, eat glass. Snitches get stitches, okay? And out here, it's rough in the streets and people are starting to care less and less. So watch yourself, okay? It's really important that when you are pursuing unionization, you don't tell management and you stand together. Get as many numbers as you can, stand together, and don't let them bully you or scare you into submission. If I could give you a little bit of my spite, I would, because I know that that could fuel a small army, okay? I'm very good at holding grudges. I'm very good at standing 10 toes down when I'm going to do something out of spite, okay? I tell you to ask my ex, but I cut that hoe off years ago despite many objections. When I went to nursing school, I had a professor tell me that I was never going to be a nurse and I need to look at plan B, C, D, and E. Okay. I transferred schools, went through nursing school, graduated, and when I did, I hand delivered an invitation to that professor that said I was never going to graduate. Okay. That's the energy you need to bring. Everybody and their brother knows that California is a princess dream for nurses. You make a shit ton of money. You're forced to take your breaks, right? You get like an hour for lunch, and then you have state mandated ratios. You want to know why and how they have that? I'll give you a second to guess. If you said unions, that's right. That union is so aggressive. So determined multi-year efforts on part of the California Nurses Association helped make mandated ratios a law in 2004 in acute care hospitals. And you know what they saw? Nurses coming back to the bedside. Yeah, so that law was signed in 1999 originally, and the union was the author, sponsor, and driving force behind it. The hospital industry has tried to overturn it or take it down, but the members continue being the pit bulls they are, and they defend that ratio. A seminal 2010 University of Pennsylvania study showed that the California law saves thousands of patients' lives, and that if California's 1-to-5 ratios were matched, surgical units in New Jersey hospitals would have 14% fewer deaths, and Pennsylvania would have 11% fewer deaths. So get your bullshit strikes hurts patients out of my face, okay? OR and trauma patients in the ED, they get 1-to-1 care. ICU, NICU, PACU, L&D, and ICU level patients in the ED get 1-to-2. Step-down units get 1-to-3. Antepartum, postpartum couplets, pediatrics, ER, tele, and other specialty care get 1-to-4. Med-surg gets 1-to-5. Postpartum women only and psychiatric get 1-to-6. A longitudinal analysis looked at the impact of California's staffing mandate and the economic recession on RN staffing levels, and it showed that staffing differences increased due to the faster growth in California staffing compared to other states. During the 2008 Great Recession, staffing remained stable in California, but it declined in other states. The nursing shortage is a bullshit narrative that is made up by the hospital industry, okay? There's not a nursing shortage. There's a shortage of nurses who are willing to tolerate what you would do working in the facility, okay? When I started traveling, I said, you can treat me like shit or you can pay me like shit, but you can't do both. There are times I think I miss it. I miss ICU. But then I see like TikToks or social media of just like absolutely off the wall bonker shit. And I'm like, never mind. I don't miss that anymore, right? I saw this one where a guy wants to leave to have a cigarette. I mean, Taylor's oldest time, right? Just smoke in the bathroom and set off the code red just like everybody else does. So he wants to leave and have a cigarette, and he starts recording because staff said no, or you can sign out AMA, and he is going off on them. He's being an absolute asshole. You go and you look at the comments and the amount of ignorant people that are defending that guy, right? Unbelievable. We're also witnessing a surge in abuse by patients that are putting us, the nurses, into the hospitals as patients. I mean, you still have that hospital admin on a recorded 911 call telling them, yeah, I'm not worried about that unconscious staff member on the floor. She might die. I'm worried about this other person. That to me is crazy. Doctors, you can unionize. In an article written in March 2024 for the American Medical Association, a survey showed that about half of the physicians were employees in 2022, and in 2024, about 75% of physicians were employees. So these are people that are being employed by hospital systems. So the idea of unionizing started, to gain traction in the employed setting because the biggest factor was being able to collectively bargain. big healthcare systems are managed by executives, and they have several layers of management between them and the physicians that actually deliver care. You can take a physician union, though, and you can bridge that gap and highlight problems that maybe management didn't even know existed because they don't know your job. They don't even go here. Okay. You shift that power back to providers, get your PAs, NPs, AP providers, and you unionize. You guys can be the antidote to some of the burnout and the turnover that you're seeing. If you hold your breath waiting for the healthcare executives to do the right thing for your patient, well, let's just say it's going to be really easy to intubate you and I don't need medication. Okay. You're going to die waiting for that to happen. We witness how healthcare has now morphed from an actual, delivery of care to where we're doing more paperwork and admin work. And the patients are the victims of this and they are suffering. But we're supposed to care about the patients, right, hospital? Pros for unions. Okay, you can establish an official process for those who are facing disciplinary action from their employers. Both sides must operate within the guidelines, helping ensure that you won't be punished unfairly or inconsistently or unjustly terminated. They can help investigate grievances, and some unions will even provide an attorney for their members, ensures safe working conditions like access to PPE, making sure you get your breaks, addressing short staffing issues, and protecting you from harassment or violence. Negotiate for better pay, better shift differentials. The median weekly earnings of unionized healthcare practitioners, including nurses, are about 15% higher than those of non-union. You can get better benefits, better PTO, better sick leave, better educational reimbursement, retirement plans, give you something that makes staying at that hospital worth it. So for shits and gigs, let's talk cons, okay? Union dues. Just like anything else in this world, you have to pay for a membership. I want to say mine was maybe like $30 a month. That's not bad. Now, I did find on a few different websites, some contracts can have mandatory strike policy, right? Where if you vote yes or majority votes yes and you do go on strike, even if you disagree with it, you have to go, right? But hey, that's politics. It also kind of touches on decisions that are being made. They are being made by majority voting. But I feel like if you are passionate about something, right, you can start advocating on your behalf and try to sway others to your own viewing. You can start a podcast to talk about it if you'd like. My previous hospital had these beds in their L&D department, and they had micro tears in them. So women were laboring on them, and obviously you expel bodily fluids and blood. So you'd push on those mattresses, and fluid and blood would seep up through those tears. Nurses complained to management, who allegedly kind of brushed them off, so they took it to the union. Union reaches out to the media, and now it's going to be covered on the news. Now all of a sudden the hospital's like, no. We took those beds out. We're replacing the mattresses. Silly little nurses don't know what they're talking about. But they got it fixed, right? We had these things called ADOs. They are assignment despite objections. And that was our way of documenting issues that we had on the unit. So a leaky mattress that was not being removed from the unit, if the step-down unit had to be understaffed and they had to go 1 to 4, if you had to stay past your shift because they didn't have a nurse to take over, if you got the absolute snot kicked out of you by a patient and nothing was done, these were the paper trails so that when negotiations came up, there was actual evidence to back up these claims. So where do we get started? Okay, you need 30% of your nurse employees to begin with. Develop a network of nurses who want the same thing you do, revolt and unionize. There are pamphlets by the National Nurses United that you can actually hand out on non-work time. You can take notes, identify issues on the different units. You can talk about how they can be fixed and how you can kind of work them into a new contract. You can have informational meetings to talk about the process and, again, take notes so that everyone is heard and that these are issues that when you have your first bargaining session, when you do unionize, you already have a list of like what needs to be addressed, right? So when you gain enough support or interest, there will be an authorization card that goes around. Nurses should sign the card once they have answers to the questions, if they have any, and they've made a decision to go forward with this. Okay, your employer is not allowed, repeat, not allowed to see the cards. If they ask to see it, you tell them to get bent. You can probably chat GPT, a more professional way to say that, but that's probably what I would say. Once you get at least 30% of signatures on that card, you turn it in to the National Labor Relations Board, and they conduct a formal election by secret ballot. And your employer does not know how you vote, and it's none of their damn business. Play dumb if they ask. Pretend you don't know English. You can't read. You were never taught, so you can't possibly, tell how to vote. Tell them felons aren't allowed to vote, so therefore you are not allowed to vote. When an election is won by a simple majority, boom, you got it. Your employer can no longer change existing practices without bargaining with you first. Nurses win the best contracts when they are well organized, unified, and committed to strong participation in their negotiations. So when it comes time to building a contract, the Facility Bargaining Council, or the FBC, is the crucial link between the negotiating team and all of the nurses in the bargaining unit. And you want representatives from all the different shifts and units. The FBC elects the nurse negotiating team, and the size of the team is based on the number of RNs in the bargaining unit at your facility. The FBC distributes a bargaining survey to every staff RN to get their opinions on a wide variety of facility-wide and unit-specific issues, and the results of that help determine bargaining priorities. The elected negotiating team and a National Nurses Organizing Committee, NNOC, staff labor representatives sit across the table from the management team. NNOC will provide orientation and training. The negotiating team keeps nurses informed through the publication of regular bargaining updates. So general meetings occur at critical junctures throughout the negotiating process. And when the team reaches a tentative agreement, it's brought back to the nurses for discussion and a vote. Before any contract goes into effect, it must be approved by a majority of the RNs at the facility via a secret ballot. But only those who are union members are actually allowed to vote. I've been in a Facebook group before with my old union where they posted, votes, offers, updates when it was our time for negotiating, and then just general stuff, right? Like, hey, I'm going to go need FMLA. Does anybody know how to apply for that? Or, hey, I got a weird thing with my check. Did anybody else? So it just kind of kept all the nurses connected, which is really nice. You can also email or text people who don't utilize social media. Hospitals do hire professional consultants, by the way, to try and shut down nurses from organizing. But those consultants typically make $3,000 to $4,000 a day doing that. And let's be real, they're not just going to hire one. So if they can pay those kinds of people that kind of money for God knows how many days trying to shut you down, they can absolutely afford raises for you. I know of a labor and delivery nurse who works at a hospital, we call it Hospital A, and they are seeing a big influx of babies. A city further away shut down their L&D unit, so Hospital A is now not only serving their community, but they're serving two others that are now being forced to deliver there as that's the only closest place. There's a big renovation that's planned, but let me tell you this. When you go to give birth, you usually have 3 nurses: antepartum, labor, and postpartum. At Hospital A, they're having the nurses be all 3 positions. There's also a lack of pediatric care, so sometimes they even get pediatric patients. With a union, you can either bargain to create more positions and hire more nurses so that way you can provide proper care for these patients, or you can create a petition with the union, have all the nurses sign it, so that way you can actually split those positions and have appropriate staff to provide safe care, because that's what we're all about, right? Safe care, patient safety. In Everett, Washington, February 2024, they had faced 10 months of negotiations. They did a 5-day strike, and they had shot down a previous tentative agreement in December of that previous year. Their new contract, it gives them a 21.5% pay increase over 3 years, better benefits, and they get compensation for understaffing in the form of increased pay and bonuses. Now, this is the same hospital that had such bad staffing issues that they were giving their med-tele nurses 8 patients per nurse. And when the nurses found out that night that when they were going to come back, they were going to get 8 again, they called out sick. They had 3 travel nurses for 30-something patients. One canceled her contract before stepping foot in that facility. And by the way, I'm going to say that this is allegedly because I don't want them coming at me, okay? The hospital had made a statement saying that, well, it's flu season. That's why there was a bunch of call outs, but there was some other BS that they threw in there. And once again, I'm saying allegedly so they don't come for me because your girl does not have lawyer money. So change has to come from somewhere. The working class has faced the challenges of unfair wages, unsafe working conditions, and that feeling that your voice doesn't matter. But when you stand together, you find that you aren't powerless at all. Your voice does matter, and damn it, it will be heard. This isn't just about negotiating better pay. It's reclaiming dignity and respect, standing shoulder to shoulder and saying we deserve better, our patients deserve better. It's about making sure that decisions about work, about our lives and our futures are not made without our voice. When we come together, we can shift that balance of power. Together, our voices become too loud to ignore. Together, we can create change. Unionizing means that no one stands alone when fighting for what is right. It means that when you mistreat one of us, you mistreat all of us. If one stands against the system, we all stand against the system. It means we can face the future with confidence because we know that we have each other's backs. The path to unity isn't easy. There will be resistance, intimidation, threats, bullying by grown-ass adults that you thought that they would have grown out of it, right? You're going to hear that it's not possible. It's not worth it. Okay. You look at history and then you tell me straight to my face that that's true, right? 8-hour workday, overtime pay, child labor laws, equal pay, better benefits. None of these rights were handed to us. They were won by the people who stood together and refused to be silent. We are stronger together. We deserve to be heard. We deserve to have a say in our future. We have the power to make it happen. Stand together, raise your voice, fight for respect, fairness, and dignity that every single one of us deserve. We are human beings. We are not fodder for the healthcare system. We are not a punching bag. We are not another cog in the machine. When you stand united, not as workers, but as a community, there is not a single thing that you cannot achieve. Obviously, this is something that I'm very passionate about. Now, working somewhere that doesn't have a union, I see the discrepancy in treatment of nurses. If you aren't angry, you need to be. If you aren't demanding change, now is the time. There are organizations out there that can help you unionize. The first step is reaching out, and I hope for your future and your patients that you do. Thank you for listening to my soapbox. I'm going to step down off of it now because I got to calm my tits or my blood pressure is going to ruin my aorta. Next week, we are going to talk about something that could help you calm down. The drug I wish I could do, the drug that I was yelling about when I was going to sleep for surgery because I really wanted some and they said no. A new innovation for all sorts of treatment. We are talking ketamine, Special K, K-Train, K-Hole. We're going to talk all about it. So don't forget to hit subscribe. You can also follow the IG and the TikTok. And I'll see you guys next Tuesday. Okay, love you. Bye.